All right, let's take a look at the conditions that I'm working under right now and the logic behind it. So, Thomas J. Argonne, our state public health official here in California, back in August 11th of 2021, created this discriminatory policy of verifying vaccination status basically for workers in schools. Let's dissect that. So, the COVID 19 pandemic remains a significant challenge in California. COVID 19 vaccines are effective in reducing infection, maybe for the person who received it, serious disease, hospitalization, and death. At 63% of California, at present, 63% of Californians 12 years of age and older are fully vaccinated, with an additional 10% partially vaccinated. Children under the age of 12 are not currently eligible for any authorized vaccines. California is currently experiencing the fastest increase in COVID 19 cases during the entire pandemic, with 22.7 new cases per 100,000 people per day, which with case rates increasing tenfold since early June. Okay, first of all, that's a lie. Let's go look at California cases. So remember, this is the August 11th order. August 11th is right about there, right? Greatest increase in cases ever. No. Okay, we can see on the chart here, we've got 3,000 cases a day up to August 11th is 11. So let's just call it 12,000. So yes, there's definitely an increase here. However, are we forgetting something? Here we go. Let's go here. We've got, I don't know, whatever. Let's go here, 5,000. 5,000 cases a day to 44,000 cases a day for a 7-day average. So how can this be the highest increase in cases that California has seen, right? Not making sense here. This is California, right? California. All right, next. The Delta variant, which is 2 times more contagious than the original virus, is currently the most common variant causing new infections in California. Okay. Unvaccinated persons are more likely to get infected and spread the virus. Not necessarily true. What about unvaccinated people who already had the virus and now have natural immunity? Oh, let's talk about that. Check this out. See this little dotted blue line in between the large dotted blue line? This large dotted blue line shows people who are vaccinated and how they fared against hospitalization against Delta. Wait a second, that means people who are unvaccinated and have already had the infection are less likely to be hospitalized than people who have never had been infected and got the vaccine. So that's false. Unvaccinated persons are more likely to get infected and spread the virus. Not necessarily true. Not if you already have antibodies. Again, which is transmitted through the air. Most current hospitalizations and deaths are among unvaccinated adults. Unvaccinated and had never been infected previously. So let's make that clear. Almost all K-12, K-6 graders are unvaccinated and will not be eligible for vaccines at the onset of 2021-2022 school year. Additionally, among 7th and 12th grade students, okay, slow down, not that much of a hurry. Additionally, although some 7th to 12th grade students will be fully vaccinated by the start of the school year, many will not. As of August 10th, 2021, less than 41% of Californians ages 12 to 17 years old were fully vaccinated. California is committed to safe in-person learning for all K through 12 students following strong public health science. No, how about following a court case? Here we have a San Diego judge saying that California is making arbitrary restrictions and keeping kids from going to school, and told California, "You're making up all these silly rules. They're not backed by science. Open schools back up." California lost that case. Schools opened back up, and here's some of that ridiculousness that was going on for arbitrary rules that they were making. Here in Stanislaus County, or actually California, here were some tiers that we were following, and whether schools could be opened or closed or not. They're saying at a rate of 7 per 100,000 people, we would have to close down. Like, I mean, our school was closed. Let me show you some calculations. 7 per 100,000. So if we have 7 divided by 100,000, that is this rate. So if we have an infection rate of that, then we need to lock down, right? So how many people are in California? That's 40 million. So let's multiply that rate times 40 million and find out what our daily um, infection rate has to be before we hit that arbitrary purple tier. That's 2,800 cases a day. If we've hit that mark, we're on lockdown. Okay, so let's go back and look at the numbers again. We were on lockdown around March 18th, I believe, 2022. We went to distance learning when we had about 428 students, or sorry, 428 people per day on average getting infected. We did not go back to school. Here we are. We're in that purple tier, purple. Um, we went back to school. I want to say it's somewhere around March, mid-March again. So just barely coming out of that purple tier, and boom, we're back in school. And also, again, that's because California got sued and we had to go back. So, fortunately, it was towards the end of the school year. Things kind of simmered down. And then, hey, if we still had that tier system, guess what? We never should have opened the schools again this year. But because the courts, not because health officials, the courts said we have to open, we're open. And look at these case numbers. I mean, what is that? I don't know. I'm doing the math off the top of my head here. It's 15,000 a day divided by 2,500. And now look at this Omicron. Hundreds of thousands of cases per day, or over 100,000. Okay, back to this. So, for example, California has implemented a universal masking requirement, which again, masks have been shown to be very ineffective unless you wear an N95 mask, as well as recommendations around testing strategies for K-12. Yeah, let's talk about those testing strategies recommended, as well as recommendations around testing strategies for K-12 to support the successful return to full in-person instruction at the onset of the school year, as well as minimizing missed school days. Yeah, testing. Who tests? Who has to get tested? Well, prior to that, nobody really had to get tested. There was no compulsory testing. That's what this health order is for now, to test unvaccinated staff members only, or people who didn't report their vaccination status. And yeah, since I'm talking about that, now let's talk about that. There are 1,500 employees at Turlock Unified School District, and I'm going to estimate about a fourth of those are either unvaccinated, they declared they're unvaccinated, or they just didn't want to share their vaccination status with the government. So about 375 employees are subject to compulsory testing in our district. Well, guess what? There are 14,000 students and 1,500 employees. That's over 15,000 people on campus every day. So let's just divide that. We'll round down here. We'll round down to 15,000 instead of 15,500. So what percent of people on campus are getting tested every week? Less than 3%. Less than 3% of the people are being tested on campus compulsorily, like against their will. They don't want, well, they have to, or we're being threatened of discipline action and being put on leave without pay. How is testing less than 3% of the population going to stop the spread of the Delta variant, which is twice as virulent or twice as contagious as the regular, whatever, alpha variant? Ridiculous. All right, back to this. Oh yeah, and now Omicron is 4 times more uh, contagious than Delta. So I mean, we're a couple orders of magnitude higher than the regular one. Okay, so let's go back here. Vaccinations against COVID-19 is the most effective means of preventing infection with the COVID-19 virus. I'll give you that. If you had never been previously infected and you got the vaccine, getting the vaccine would prevent you from the infection of the actual virus, the full virus, not just part of the mRNA. So, Now, the second half here is a lie. And subsequent transmission and breakouts. Lie, lie. Let's talk about that. Vaccines. The director of the CDC says that while vaccines are doing very well to protect against serious illness and death, what they cannot do anymore is stop transmission. So, uh, are they stopping transmission? Are they stopping outbreaks? Right? Or preventing infection? Are they preventing transmission and outbreaks? No, no. Again, our vaccination started in 2020, right here around this time. Um, People are getting naturally immune throughout this whole process as well. And right, more and more people are vaccinated. 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 Hey, let's start going back to school, everyone. Boom, 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 boom. Infections are increasing. Even more people are being vaccinated through this time, especially right in this area when people are being coerced by the government to get vaccinations, and the vaccinations rates are going higher and higher and higher. California somewhere around 70 something percent, and there's it's going to prevent those outbreaks. Oh, hey, we lied again. Not preventing any outbreaks. Oops. Oops. Pause that. Let's see. Okay, so current CDPH K-12 guidance strongly recommends vaccination for all eligible individuals, thereby reducing COVID rates throughout the throughout the community. Hasn't happened, including in schools, and creating a wraparound safety layer for unvaccinated students. Hey, what about the staff members? They don't care about staff members getting sick. This order, consistent with the recommendations, requires vaccination verification of vaccination of verification of vaccination status among eligible K-12 school workers. We're not going to care about the other hosts on campus, the 15,000 students. We only want to know about the 1,500 workers. Let's see. And establish diagnostic screening tests of unvaccinated workers to minimize the risk that they will transmit while on K-12 school campuses. Vaccines don't even slow down transmission. They're not able to stop transmission. So what is doing checks to see if you're vaccinated doing? Nothing. Where the majority of students are not vaccinated and younger students are not yet eligible for vaccines, they're also not getting sick and dying like the staff members. Schools may use funds, blah, 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 blah. Yeah, so now I am subject to compulsory testing every single week, no matter what. Even though I have immunity and I fall in this category way down here, I still have to get tested every week. What else did I pull up here? Okay, yeah, so the tiers, I showed you that. I'll show you the current state of California and this health order that went into effect here, which is doing absolutely nothing. Um, yeah, again, we had, let's look at the time frame here. So vaccines started coming into play here. Health order comes into play somewhere around here. How do they say this is the worst infection rate we ever had? No, not even the highest hospitalizations. Lies. Oh, it's going to prevent transmission. It's going to prevent outbreaks. Really? Really? Didn't. Another lie. Okay, so I'm just making sure I used all my tabs here that I was talking about. Yep. There's our numbers for the Turlock Unified School District. 1,500 staff members plus 14,000 students. So I'm just saying 15,000 people on campus every day and testing less than 3% of those. Oh, yeah, yeah, yeah. They want us to give our vaccination information to the government. We're public employees. Schools are Department of Education. That's a state government agency. We get federal funding as well. So government wants my information. Well, due to the Fifth Amendment, I don't have to give it, right? Nor shall private property be taken for public use without compensation. So I'm not volunteering my information to the federal government. If the federal government wants that information, they're more than welcome to go get it right here. They could go ask my doctor or whoever they hired to get me tested weekly. Uh, they can go ask them. They can go ask her, that covered entity, the person they hired, to tell them either if I'm vaccinated or not, or what my weekly test results are, because they can prevent, right? They can prevent a person they can give that information to a person or persons reasonably able to prevent or lessen the threat. So if my district says, hey, we need this guy's information because we can keep him out of a crowded public schoolroom so he doesn't spread the virus. So instead of me voluntarily giving it to them, I'm telling the government, no, go use the laws that already exist to go get my information without my consent. And when you do that, I do want compensation because you're taking my private property for public use. But nope, uh, they just want me to hand it over free. And, oh, and again, look at these. Look at this flow chart. Again, I, as a staff member who has immunity to COVID-19, am subject to weekly testing because I'm considered unvaccinated. Because everyone's ignoring natural immunity. Oh, except I give you this. They look at it for about 90 days only. And if you have a prior infection for 90 days, um, then that counts um, for 90 days. So they're ignoring natural immunity, and they're ignoring the fact that I documented that I have immunity. So again, my district doesn't even know if I have natural immunity or if I got vaccinated. My thing is, I just didn't give them vaccine information. They don't even know how I'm immune, but I'm immune. So anyway, let's talk about this. If a student's exposed at home or at school and they don't have symptoms, no, they don't have to quarantine, right? They don't have to quarantine. Asymptomatic, been exposed, don't have to quarantine. I'm asymptomatic. I, as far as I know, I haven't been exposed either. Do I have to test? Yep, I have to test. Different standard for employees. So I'm asymptomatic and no exposures, but I'm testing every single week, every single week, every single week, every single week, despite having immunity. Despite having immunity. Yeah. The 14th Amendment says all people should be treated equally. And now those people have to have similarly situated circumstances. So, um, and so I'm immune. Other employees are immune. I have to test weekly. Other employees don't have to test weekly. We both have immunity. Again, that is unequal treatment under the law. And the courts, however, have let that go through because this is ridiculous. Because vaccine policies can be based on government information that's been disseminated, authentic government information that's been disseminated, regardless of if that information is factual. This keeps coming on. So, there was a recent court case where a medical ethics professor, Dr. Cariardi, was fired in California, worked at the UC system, went to court, took it to the Ninth Circuit. Ninth Circuit upheld that the college could create a vaccine mandate because it used authentic information from the government website. And the court admitted that the facts were disputed. The facts that the CDC and FDA put out were disputed, but the authenticity of the websites that they pulled from are authentic. And therefore, all the courts had to do was decide if the UC system made their vaccine policies based on rational basis review. So, oh, it was rational because it was from an authentic website. But yeah, who cares if it was factual or not? It was authentic. Anyway, that's where I'm at with this. Frustrated that I am being discriminated against, that the courts have given the lowest level of scrutiny to these vaccine policies. And these vaccine policies are not using data in order to make fair policies. That's it.